Good morning, hello, and welcome to this webinar on driving care continuity with rostering. For those of you who are not familiar with Log My Care, we provide an intuitive care management platform loved by providers across the entire care spectrum. Designed in collaboration with both support workers and supported people, Log My Care is trusted by over 1,300 care providers who praise the platform primarily for its user-friendly functionality and suitability across the care sector. And the timing of this session is really great because we have just launched our brand new rostering add-on, which is why we're so keen to be deep diving into this incredibly important topic. We all know a well-designed rostering system plays a crucial role in maintaining care continuity by effectively matching carers and service users based on past relationships, preferences, specific needs. We can enable providers to deliver seamless, meaningful care. As I mentioned, we'll be keeping an eye on the chat throughout this webinar, and we'll be running some polls, so keep your eyes out for those. And please drop any specific questions you've got for either of our two speakers, and we'll have time for a Q&A at the end. But that's enough from me, Josh from Log My Care. I'd love to introduce our two speakers for today. We've got Mark Tops, a true care sector expert and founder of The Caring View, the UK's leading care podcast, which I always think is a great listen. And from Log My Care, we've got our very own Sam Hussain, the CEO and founder of the company. Good morning to you both. I know we've done a little bit of chit chat about how the weather is, but both excited to jump into care continuity with rostering.
Yeah, of course, Josh. Can't wait.
Yeah, no, definitely. I think it'll be a good conversation to have. So I think rostering's a hot topic in social care all the time. And I think anything we can do to drive up the continuity of care is crucial.
Well said, Mark. Well said, Mark. Look, thanks both for joining me. We'll kick off by doing some kind of groundwork. I'd love to ask you, Sam, if you could give us a little bit of a refresher on the term that we've said so many times. So kind of what is continuity in care? And from your point of view, why is it so important for supported people?
Yeah, sure. So, the way I think about continuity of care, it's one of the major factors that drive into a person's experience of being cared for. And, I think, all the best organizations are driving towards how can we deliver the best possible experience to the people we support. Two aspects really being, first, there's quality of care, making sure we always have highly trained, highly able staff turning up. And then there's the continuity side. How can we deliver a seamless, consistent experience where we're, consistently getting, a friendly face there every time, someone who's built up a relationship with that person. I think there's a lot behind the relationships in care, and continuity of care really it's all about building trust. I think it's a trust building exercise between not just the people who are visiting regularly, but really with the wider organization. If you're able to prove that time and time again, you're able to deliver that friendly face to someone, then I think you're doing a great job. And, why is it important? I think think about it from the perspective of the person being supported. They want to have someone they trust, someone who knows them, someone who knows their specific needs, preferences, how they like to be spoken to, how they like to be supported. And so it's kind of critically important for them to get that continuity, consistency, and not just for them, for the organization as well. I think there's a really virtuous cycle here. If you provide great continuity of care and it gives back to the org as well, you'll get better inspection ratings, more referrals from local authorities, I think a lot more word of mouth. And that all comes really from the person being supported, having the best possible experience.
That's great context, Sam. And there were definitely some really key nuggets in there. Mark, I'd like you to talk, maybe continuing the themes that Sam brought up. And from your experience throughout the care sector, are there any really common challenges that you think the community and some of the people joining us today will have faced regarding care continuity? And how have you seen these addressed when it comes to choosing the right rostering system?
Yeah, no, thank you. I think for me, the biggest thing is around the training for that person that is doing the allocating of the visits, whether that's your registered or your deputy home manager, or whether you've got a planner if you're a home care organisation. I think quite often somebody is employed for the role, they're put in front of a system or a paper-based rota, but they don't have the skills and the ability to know actually what they should be looking for. I think when you're doing that recruitment, whether you've employed somebody from the local area that might know those roads, knows the local traffic, or whether you've employed somebody from outside of that district that might not know those kind of nuances. And I think then there's the common challenges which all providers face, which is obviously the staff shortages, so recruitment issues or retention issues or both. Then on top of that, you've got sickness. And I think people are obviously dropping rotas or changing rotas. And I think sometimes a lack of communication from, especially probably more so in home care, from the office to the workforce, maybe around actually we've had to change this visit, why have you had to change that visit? If somebody's offered to do overtime, delays in confirming that overtime, and then that staff member ends up picking up another shift either with another service, or they end up doing something with family or friends. And I think that all knocks on to obviously the continuity that you can then end up providing to somebody, because there's so many different nuances of change there. And I think obviously having a system around compliance, so if you've got staff that might be due training that's due to go out of date, or visas that are meant to supposed to be expiring, or even working time directives. And I think if you're not alerted to that, actually, if your policy says that you're not going to allocate to those staff once those have expired, you might have to change rounds and runs, and again change that continuity that you were planning to do. So I think for me, communication is key in everything that we do. I think honesty from the office or whoever's doing the rotas about if you are struggling, is it due to lack of staff? Is it because of sickness? What are those reasons? Because I generally think that if your team are on board, then they're more likely to support you than if they feel that actually you're just trying to, cover the shifts and there's not actually any kind of reason for it. I think obviously we spoke about not confirming overtime. The second somebody picks up a shift, confirm that with them, book that in, allocate their rota so they know what they're doing. And again, just letting staff know changes to rotas. And I think once you've got continuity of care, that becomes even more important, because if you're taking somebody away, a visit away from somebody, and they're going to be supporting somebody they really know to somebody they might not know so well, actually the first thing they're going to be doing is on the phone or coming into the office to double check, actually, why have you taken this person off me? I really want to go to them. So I think that communication is key. And I think the only other thing to remember is we all know the staff that pick up regularly will always pick up if somebody's gone sick, if there's a shift outstanding, a rota outstanding. But we need to remember, burnout, the mental health of our workforce. And I think, the CQC have spoken about it, the Skills for Care workforce talks about it around good mental health, preventing burnout, which in turn will then reduce that retention.
Yeah, that's really interesting, Mark. We've run a poll in the chat as well. I think a lot of people agree with some of the themes that you speak about there. But what jumped out to me is just how all of them are about the people, whether those be the carers or the supported people, and how much a rostering system can take some of that stress off your hand. I think you highlighted really nicely there. Turning to you, Sam, and following that theme, I'd love you to explain how Log My Care's rostering system is designed to enhance that care continuity, and any kind of specific functionality that you would call out here.
Yeah, of course. Well, taking a little step back, we had a really wonderful opportunity presented to us that to build a rostering system for care, because we've been in the market for 7 years with our care planning software. We've spent all our effort and time building the best possible platform we could there in that area. And so we have already a really rich starting point of, we know about the staff, we've got their training, and as Mark was mentioning, we know when those are expiring. We have all of the service users profiles. We know about you know, their needs, their preferences. We've got all of that rich background. And what we wanted to do was to, you know, not just design a generic rostering platform that, you know, many other systems have come from other industries like restaurants, hotels, and they you know, they might be able to work in care, but we wanted to build something that was fundamentally for the care sector. And so we approached it very much from the mindset of, you know, how can we build this to drive up continuity of care? That was one of our fundamentals. And yeah, just to speak to some of the features there, I think the most important one that does this is really our matching. So our matching between, you know, which staff are served up as recommendations for allocations to visits or shifts. And we do that in a few different ways. I'll just talk about a few of them now, but you know, you can define care teams for an individual. So, you know, if you already have a set rota schedule, you're able to say, okay, you know, Mr. A always gets cared for by these select team of carers. We also do matching up based on the skills of your staff versus the needs of the individuals. So we can serve up the most appropriate staff based on their training and or preferences. And finally, we're able to also serve up the best recommendations for matches based on continuity alone. So who has looked after this person the most, you know, over the last week, month, or who are the best, you know, plan B options if that person's not available. So that's really how we approach it. We're trying to not automate the rota fully, but we're trying to serve up the most tailored and highest continuity matches possible.
Got it. That's really interesting. So it sounds like we're empowering, like Mark said, that person who's going to be creating that rota who knows best, but giving them all the information at their fingertips.
Yeah, that's exactly the approach.
Perfect. And it's incredibly exciting. I mean, I've been in the office with Sam and the rest of the team, and it's great to have seen how much we've listened to staff and supported people and taking their opinions into what exactly they need from that tailored rotoring system over some of the generic ones. I know, Mark, you have probably used, I'm sure you can't even count the number of different rotors and rostering systems you've used. Can you share any specific examples of how a really good rostering system has positively impacted the care that you've been able to provide to clients?
Yeah, no, definitely. And I have used a number, and I can definitely tell you the disadvantages of not getting it right as well. But I think the benefits, there's definitely two. I think from the staff point of view, you've got staff that are comfortable using a system, that, you know, feel empowered to use a digital system. They've got the knowledge of how to use it, which increases your staff retention through job satisfaction. And I think they get to know the people that they're supporting, so they build those relationships. And I think that continuity impacts all of those things. And I think when you've got staff that have that continuity of care and they're building those relationships, they're more likely to turn up to work, they're more accountable, they want to deliver that care. And I think a case study, I remember looking after somebody when I took over a service many years ago who lived with learning disabilities, was deaf, but also had challenging behaviour. And there was a number of people that, you know, would support this individual, and the turnover of staff was high because of those needs that he had. But actually getting a core team in there that were skilled, were trained, you know, wrapped around him, got to know him really well. Actually, we saw those anxieties that he had because the routine became more normal for him actually reduce. And then it was the knock-on impact of that. So actually, with that reduction in his anxieties became the reduction in his behaviours. And obviously there were other things as well as continuity of care involved, such as, you know, liaising with healthcare professionals and behaviour specialists and bits and pieces. But we saw a reduction in his medication need, getting back out and about into the community, requiring less staff. So when I very first started, required two staff to support him, actually got down to requiring one member of staff. You know, this was over a long period of time, but then eventually went on holidays. But it's then the knock-on impact, which I think sometimes you don't see with continuity of care, which actually for this gentleman was actually that the relationship with his parents and his sister got a lot better because actually he was able to go home and spend more time with them without a carer, whereas before it would have just been a pop in or maybe meeting at a cafe or somewhere. And I think we don't necessarily see that side of things. So I think there's many benefits of continuity of care, but I think it's just that knowledge and that impact that you can have on somebody just from building those relationships.
That's fascinating. I love how your kind of first example that jumped to mind there, Mark, wasn't about necessarily staff, but about how much of an impact that your internal systems can have on your people that you're supporting. And that's a massive successful story, and sounds like a complete turnaround for that individual. So that's fabulous to hear. I'm going to throw to both of you, but I'll let Sam answer first. I know that was a great example from Mark. Looking forward, Sam, how do you see technology such as kind of advanced rostering systems that are care specific shape the future of care continuity in the sector?
Yeah, well, I think, look, there's technologies which are becoming available today, especially around smart matching, which we've discussed a bit already. But when that is truly linked to the care record, I think it's going to be the most powerful. But the other side of it is no one, I think, has really thought about care continuity as something to actually drive up before, as in, I don't think many places are measuring it and thinking about how they might be able to quantify, what is their baseline continuity of care today. And that can be actually surprisingly easily done, like something we're working on at the moment, because every match, every visit can have effectively a continuity score. How was this the perfect match available? That can give you your baseline as a service, and then depending on whether you use a system that is serving up recommendations and take those recommendations and act on them, you should be able to see that score going up and up over time. And so that's, I think, something to that's a technology that's basically immediately available. But where I definitely see the world going, and Mark and I have discussed this previously, is AI is absolutely going to play a role here, and rostering is a big complex challenge for coordinators that has multi variables, and it is absolutely over the coming years going to be possible to optimize for whichever variables are most important to you. And I hope in many cases that is continuity of care, but there's absolutely no reason why AI won't be able to serve up, a pretty much predicted, completed, automated rota that is optimized for continuity of care, gets the best possible matching of available resource to available needs. So that, I think, is not very far away at all.
That's really interesting, Sam. So it sounds like you feel like we're at a point where we can suggest the most appropriate matches, but taking some of that decision making out of the hands of a rota admin, say, and empowering them to think more broadly about the care that's being provided. That's where you see the most benefit.
Yeah, and look, smart matching is a simple form of AI that is sort of available today, and it's not scary and it's not dangerous. We've still got a human behind the wheel. At times over the future, the tech is just going to do more and more safely, step by step, to kind of get towards that perfect world of automation.
But
while also keeping the people being supported front and center. Like that's the risk that you can't take is doing too much too soon.
Yeah, absolutely. Baby steps. You stole what I was going to say. And also just keeping the human touch of that person who's familiar with everyone, because sometimes they might know something that the system may never know. And I think Mark spoke about that really nicely earlier. Mark, I'll throw the same question to you. How do you see technology and rostering shaping the future of care continuity?
Yeah, no, I think firstly, just listening to Sam, he's absolutely right. I think a number of the systems, it's based on, if you're a home care provider, actually that reduction in mileage, so actually looking at it from a cost point of view rather than a continuity point of view. And I think if you're a care home, you're covering shifts, but you're not necessarily thinking about actually which carer is supporting which resident on a day-to-day basis, and whether they're doing that on a, regularly or just ad hoc and as and when. I think absolutely AI is going to play a massive part in tech going forward. And I think on top of what Sam's spoken about, and going back to kind of what I said earlier, it'll be around that communication. So actually, any changes, whether the AI is making that for you or whether it's predicting that, it can do that seamlessly, quickly, but then it can notify the staff on the tail end of that. I think the other things with tech advancement will be around how we utilize data. I think at the moment, social care, maybe not for you guys, but for a lot of us, actually, we're not digitally savvy. We're digitally kind of poor in those skills. And I think over time, actually, that skill set will change, and how we utilize data, because we've got so much of it from using digital systems, can actually drive some of those decision making and those, just drive it forward. And I think some of that will be about how we utilize staff. So I think if you're a home care provider, yeah, you might be looking at, the reduction in mileage, but actually the utilization of your frontline staff and how can continuity of care and where the people that you're supporting live and your staff live can play a part in that. And I think, like Sam said, it will be that integration with health records, just to give that holistic, joined up, person-centered care that I think we've spoken about for many years, but I think is kind of right there on the horizon, ready to be grabbed and rolled with.
Yeah, you bring up a couple of things, but I love your kind of ending point there, Mark, around making sure that those rotas aren't detached from all the great notes and care records that staff are creating, and hopefully those two play well together. I know I've just asked you to talk, Mark. I'm going to come back to you and just kind of pick up on what we've been talking about throughout. That there'll be loads of people listening to this now and in the future who want to get a rostering system, whether they are moving from an Excel spreadsheet or have a kind of general one in place at the moment. Thinking back to all the different ones you've used and how you might have picked some of those, any advice that you would give to those people listening who are looking for a rostering system to improve their care continuity?
Yeah, I think if you're a paper-based service, and I've definitely been there and you're comfortable using paper and it works and you don't kind of see the other side, is networking with some providers that are already using rostering so you can see that side of things. I would definitely advocate for it, because, things that I just spoke around actually the data that you can pull out of that to drive your business forward, you can't get from a roster. Also thinking about, there's going to be a drive for net zero from the government and sustainability. And actually, if you're paper-based, you're never going to be able to achieve that. So actually a digital rostering system will enable you to do that. I think if you've got a digital system already, is listen to your staff, involve your staff in that feedback, because actually you might have one, but it might not be working effectively for your organisation. And I think there's nothing worse for your staff team that might be using it if it's not fit for purpose. And I think for anybody, regardless, if you're looking, is to do your research to ascertain what you want to achieve from it. So obviously we hope that it's around continuity. So obviously make sure that you know what else you want from it. Involve teams from all levels, not just, your senior teams. Make sure you're involving your frontline staff. If you've got coordinators, planners, involve them in it so that actually they can see what that system looks like, how it feels, whether it's going to meet the needs of the service. And also involve the people that you're supporting if they've got capacity to do that. Actually, what does that look like for them in terms of continuity? And I think just keep a scan of horizon. Obviously, like Sam said, tech is continuously changing, as are the systems. So actually make sure you're looking at actually what is out there, looking at kind of actually my contract ends in the next 3 years. What could be out there in the next 3 years from a system? But yeah, I think the biggest thing is to involve your staff and to do your homework.
I absolutely love that. And funnily enough, Sam, it reminds me of how the team first went around designing our roster system. It's exactly what we did. We went to staff members for services that use the care management side of Log My Care to really just see what they thought. So it sounds like that's good advice if you're building one or choosing one. Mark, I'll keep on that theme with you. We talked a lot about involving staff, both in terms of how much a rostering system can impact them day to day, but also in kind of choosing your rostering system. Could you tell us a little bit about how a well-structured rostering system has impacted staff morale and retention in some of the organisations you've worked in?
Yeah, I think it's around the work-life balance that we know that all of us should have, but all of our staff should have. And I think if you've got a rostering system that is set up correctly, so your staff's schedules are set, their days to work are set in that system, whether that's an AM, a late shift, whether they're working ad hoc, they've got their set days off, allows them then to be able to utilise that time when they're not in the building or not working for you to actually plan outside things, but also it allows them to work out whether or not they can do overtime or not. And I still hear from a number of providers that are still giving out rotas on a Friday, ready for Monday. And actually, I just think, how do your staff ever plan anything kind of in the future if they don't know what they're working kind of one week to the next? I think in terms of morale, it is what we've spoken around, is that continuity of care and getting to know somebody, that truly know somebody, and to build that relationship. And I remember once listening to somebody talk about actually, you know, if you're supporting somebody, it's not just a person, they become, you know, like your brother or your sister or your nan or your granddad, and actually it becomes an extension of, you know, your extended family, so to speak. And actually then you want to do the right thing, you want to turn up to work, you want to deliver that high quality care, which then drives down, like we said already, that sickness, that turnover. And I think alongside, you've obviously got to embed kind of the training and the upskilling for your staff, but I think if you can give them a rota that enables that work-life balance with the continuity of care, I think staff are more likely to stay because they know that they won't get that with a number of other organisations. And I think a lot of what I've spoken around is kind of with a home care hat. And I think if it's a care home, actually having consistent teams actually builds those relationships. So actually getting to know your colleagues on shift a lot better actually really helps. And I think it aids friendships, and again, will probably reduce your sickness because actually staff want to come to work, they enjoy working with those people. And I think all three of these things that I've spoken about just lead to kind of a happier staff team.
That's fascinating. It impacts so many different parts, whether that be, you know, staff building relationships with service users or with other staff members, making them enjoy work more, improving morale, making them more likely to not be calling in sick or not take up shifts from another service. Again, improving that continuity of care and therefore the quality of the care provided, it sounds like.
No, absolutely.
And I think something you touched on there, Mark, which is really interesting, is around sickness or last minute absences, we'll refer to them, which is so prevalent. And I'm sure every rota manager listening is probably their absolute fear. Sam, could you tell us a little bit about how Log My Care's rostering system supports our rota managers to adapt to these unexpected changes, whether that be someone calling in sick last minute or, you know, anything like that, while still maintaining care continuity?
Yeah, absolutely. I'll take that example of, hey, someone calls in sick and what happens within our platform. But, you know, straight away, someone calls in, you would go to the visit, take them off the visit. They obviously immediately get notified, but they would know already. Then what happens straight away is our monitoring dashboards kick in. So we have built specifically a monitoring dashboard that helps care services keep on top of these, you know, last minute changes, any upcoming issues, clashes that are coming up in the rota. We like to really make those, any of those potential issues, like front and center and really obvious, and then really quick to go in and solve each one. So, you know, your aim is always to get that monitoring dashboard back to being fully green, but we make that very simple. So in this case, you know, you'd have a little alert come up on the monitoring dashboard saying, hey, we've got an upcoming gap. You know, we've got a visit with no one who can attend. We then, straight from that dashboard, will serve up recommendations based on, you know, who spent the most time with that person on the topic of continuity of care, based on who's got the best skills match, based on, of course, you know, which of your staff are actually available, because we know about your staff availability as well. And really, we're able to, you know, within seconds, provide the best possible plan B option available. You know, you might have lost your plan A, but with the perfect continuity score, but how can we give you the next best option of all the available possibilities? Because, you know, you might have thousands of different available options, and we serve up the best next one.
Got it. So put simply, it sounds like making sure that those rota managers have immediate notification, feed them that information, and then support them with a few different options around who could be the best person to take over that shift.
Yeah, and I think lastly, making sure any changes are just instantly pushed out to staff as well, and acknowledged by them. So it cuts down on some of the need for phone calls, WhatsApp groups, all that sort of thing.
Yeah, that's really important as well. I'm sure all our carers or staff members listening will have remembered that WhatsApp about that shift that they're now going to be doing tomorrow. So hopefully we'll be able to help you avoid some of those. I think I'd like to ask you, Mark, kind of thinking about different parts of a rostering system. From your experience, what are the signs that a rostering system is going to be effective for enhancing care continuity within your team?
I think for me, the biggest thing is going to be the feedback from your staff team, but also the people you're supporting. Actually, you probably will see a reduction in those, especially if you're home care. Oh, actually, I've seen a different person at those reviews that you're having. I don't know who's coming, I don't know what time they're coming, all those things that pop up. Actually, with continuity of care, you're going to see less of that. And actually, you'll see more positive of, oh, actually, Bella came to support me today and I really like her. Really, she meets my needs and she knows me. And, all of those positives will shine through. I think from your staff point of view, in your staff surveys, and just generally speaking to staff every day, I think they'll be more positive that actually they are getting to know somebody, that they feel like they're actually truly making a difference to somebody's life. And I think definitely if you're home care, and I manage a reablement service, actually, I know that actually by seeing people, you don't have that continuity of care, is that you've got to ask somebody their story 101 times, and nobody wants to do that. And I think, it will be those health outcomes that improve as well, because I think they'll spot a deterioration or they'll spot something's not quite right with the person they're supporting, so they can either phone the next of kin, phone the GP or the office and get some support in there. So actually it makes you more responsive as a service. I think we've already spoken around the reduction in sickness, but I think it's still a metric that you want to monitor, especially as you kind of look to build continuity into your raters. And I think it will just be around that reduced retention off the back of that, but also that increase in the work-life balance. And again, it's a metric that you definitely want to score, whether people feel that they've got a better balance at work than they did previously. So I think there's a number of different metrics that you could monitor, but I think the biggest one is going to be the feedback from the people you support and your staff team.
Yeah, that's fascinating. I love the combination of, qualitative, asking staff members exactly how they're feeling and what they think about how they're getting their shifts, but also those hard numbers that you spoke around how much sickness, how many times we're changing shifts last minute. I think both of those are going to really impact and really enable people to weigh up, is their current system working for them, or is that what's holding them back in terms of continuing to level up the care that they provide? I'd love to kind of thinking about services that might want to switch, especially if they're paper-based or they have a more general rota system in place. There are going to be 101 different things that stop them from thinking about a change, but are there any challenges for organizations that really stand out when implementing a new rostering system, and any ideas of how we can typically overcome those? I'll ask Sam first.
Yeah, sure. I'll talk about a couple of the challenges I've seen providers have. And one of those has been implementing a rostering platform that's not linked to their care record. And so, there's a lot of challenges that go with that. You can't get the best matches. You can't control who has access to sensitive data at the right time. And also, you get your staff having multiple systems as well, which is always painful. So, a way to solve that, as you were asking, Josh, is to make sure you do have one that's fully integrated with your care management side. I think that's really important, and I think you've got to test that integration as well, not just a skin deep integration. It needs to be a really deep one. And then I think the other big challenge that I've seen is generally around an increasing, in the care sector, an increasing prevalence within organizations that they have multiple modes of care. So they're not just pure home care, pure residential care. We've seen obviously a lot more supported living coming up over the last few years. That's often infusion in alongside residential or home care. Also, a lot of especially complex care services will have day centers. So within one company, you can have 4 different modes of care. And I've seen a lot of providers have to have multiple different rota systems to cope with that, because you can get shift-based, more generic software from other industries that can work for the residential side. It's harder to find home care software, but there is home care software that can handle visits. And really, I think until I will talk about our platform, but until the rotoring software that we've just released, I think there was no software that can handle the whole spectrum of care, both the shift-based style of working with the remote worker visit-based schedules as well. So I would say look at what are your modes of care and make sure that you've got software that can handle it.
Thanks, Sam. You're making my head hurt with trying to think about remembering 2 passwords for a care management and a rota system, let alone 3. So I can't imagine anything worse. And it ties in really nicely with one of the polls that we ran earlier, where the overwhelming response for people thinking about changing their rostering system was around how customizable it is to their needs. And I'm sure having a system that is enabling shifts and visits will be something that is on everyone's minds. And if we've got any kind of owners or business directors, enabling a service to grow across care verticals is, like Sam said, something we're seeing more and more. And the last thing you want is to purchase a couple of supported living properties and then realize you might have to look at another new system. And these unexpected costs can definitely get overwhelming. Mark, I'd love you to comment on the same question, if that's all right. So looking at your experience, what are the kind of common challenges that your organizations have faced when you try and implement a new rostering system?
Yeah, so I think from an operational point of view, it's time. So I think you might be a service provider, a manager that knows that actually the system you've got isn't meeting your needs, and you might flag it, but then something else comes across your desk and you forget about it for a few weeks, and then a few weeks turns into a few months. I think when you do finally have that, that time, or somebody is looking at it, quite often in an organization, it will be, directors, CEO level, and actually whether they choose a system that isn't fit for purpose. And I know I spoke about earlier actually involving staff from all levels of the organization, and I think that's absolutely key. I think then you might go through your procurement and you procure a system, but then again the time factor comes back, so you don't properly mobilize it out, so you forget training, you roll out half a system, you put in some workarounds for part of that system, and I think then you're left with something that doesn't meet your needs. I think listening to kind of Sam talk there around the system abilities versus like the company need is, I think, absolutely you need something customizable. And I think I'd urge any provider that if there is something they need from the system they're using, is to reach out to the system they're using, because they'll probably have a roadmap of what they've got in the future. Is what you need on that roadmap? And if it's not, can they add it to that roadmap? And I guess then you've got your answer actually. If they're not going to add it to your roadmap and it's something you absolutely need for your business need, then you can go and do your research and shop around and move to a different system. But definitely think you need to set time aside. It's not a 5-minute task. It's a bigger walk in the park, unfortunately. But yeah, it's that homework and involving people of all levels.
Absolutely. Yeah, it's certainly not a 5-minute task, even if we'd love it to be. Talking about time, are there any kind of specific times when you're like, this is definitely the right time to review this in previous organizations, or any kind of things that go on with an organization where you're, actually this definitely isn't the right time?
So for me, I think if you've just got a new contract, it's probably not the best time, because you'll be focused on mobilizing that. I think there's never going to be a perfect time, because you'll set time aside and something else will come in that you weren't planning for. The CQC will knock on your door, or something will happen. I think for me, it's finding that core focus group that want to be involved. So whether you've got, your rota manager, a planner, a frontline staff member that is continuously saying, actually, the system isn't working for us, is grab them straight away. They're going to be your key player to looking at another system. And you can always allocate that to them. Actually, you go out and you look at the systems that are available on the market and feed that back to us. I think it's then getting the buy-in from your senior team about, actually, this is why you want to do it. And there will be a cost element to changing your system, but actually the return on investment might not be actually savings in the system, but it might be actually that you've got happier staff, which will increase retention. You can talk to them about continuity of care, all the things that we've spoken about today, about actually it's going to deliver better outcomes for people, actually, might save costs on staffing long term. So I think there's so many different factors that we don't see with a good rostering system. And we quite often hear the ones, unfortunately, when it's not working as well.
Yeah, thanks for that, Mark. I think there were some great kind of green flags of when's a good time to look, and also red flags where you might want to hold off. But I love the idea of deputizing someone who's really keen and wants to be involved, and empowering that person to make the change within the organization is fabulous. I just want to remind everyone, stick your question in the chat. I've got one more question for Sam and Mark, and I'm going to be looking for you guys to help quiz these two. My last question, I'd love to, again, follow this theme of looking ahead. Sam, what emerging trends do you foresee influencing care continuity? And is there anything that providers can do to prepare for them?
Yeah, I think we are in the middle of a trend that is just continuity is being more and more spoken about. I think, if I think back to when I first got into care, I think there was so much more focus on pure quality, just the raw quality of care, and continuity of care has really, in the last couple of years, come much more to the forefront. And I think that's because there's so much more focus, from regulators on the experience of the person being supported. And that's going to be an ongoing trend. It's really in terms of how people can prepare. It's making sure you've got, the ability at your fingertips to evidence and demonstrate how you're thinking about care continuity. That might be in being able to show particular features to an inspector, like, hey, this is how we do our matching. This is how we think about, and this is how we prioritize getting high continuity matches. But also, I think in reporting, right? If you can have reports that show this was our baseline, then we really started thinking about care continuity, and we can show how it's gone up and up, then I think that'll also be a really powerful thing.
Got it. Yeah. And what do you think, Mark? Do you see kind of similar trends around care continuity?
No, absolutely. And listening to Sam there, just making some notes, I think, how we utilize data. We know with the single assessment framework with the CQC, actually feedback, is over half of what they're looking for. And actually, if you've got staff that are saying actually that they're delivering high quality care, you've got the people you're supporting saying that they've got continuity of care, actually it's going to go really in your favor with the regulator. And I think we're seeing more and more inspections from local authority under the PANS audits. Continuity of care comes up in that time and time again, something that local authorities are definitely watching and monitoring. So again, you'll be meeting that there. And I think the only other thing that kind of the trend that I'm kind of seeing more and more of is those self-managing teams. And I think there's only a few organisations at the moment kind of that I'm aware of that are doing it, but I definitely think that that'll kind of grow as kind of people understand how that works, with staffing. It only takes for the government to change the rules on, sponsorship and visas, and we're all going to have to think about actually how we manage our services very differently for those that are utilising those sponsorships. And I think it will be around what we've spoken about earlier around AI and how we integrate that into our systems.
Yeah, I love that. Whether it be tech or whether it be government rules around visas and sponsorships, I think having a system that's going to allow you to adapt to the crazy world that is the healthcare sector is really important. Thank you both for the fabulous answers that you've given for all of my questions. That's it from me. Please, everyone in the chat, make sure that you are showing your questions in there. I know a couple of people asked some questions around the features of the Log My Care rostering system. I will give you a brief overview of exactly what the system does before we finish up. But apologies that we won't be doing a full demo now. I would love to ask Mark just a little bit more, because I know Russell really agreed with you, and we were asking the biggest constraints around an organization picking up a rostering system, and he said it's just time to consider a system within the constraint of a pressured care service. I know I asked earlier any kind of green and red flags, but are there any kind of processes other than deputizing that have enabled you to make that process a little bit less time consuming?
I think the only thing for me is forward plan. So actually you might realize that you don't have the time right now, but actually we always, all of us, forward plan for if we're going on holiday. We make sure that actually that's blocked out of our diaries, that we haven't got meetings and bits. So actually, if you know you're busy right now, we're in the run up to Christmas and that's busy for every care provider. Actually, what does your new year look like? Could you just block a week or 2 weeks at the end of, end of January, which won't, feels like a long way away, but isn't, so that actually you've got that time allocated out now. There's probably less likely to be something in that calendar. That gives you time to then break that into bite-sized bits between now and then around actually who are those staff I'm going to utilize to be involved in this. You could possibly have some research calls in between if you've got, an hour here and there. And I think it's just breaking that into the smaller bite-sized bits so that actually you've got everything you need to make that informed decision. And I think utilize AI, if you need a business plan for your directors, for your senior team, actually, what can AI currently do? There's a lot of free models that are on the market at the moment that you could also, you'd have to check it for the data that's coming out of it, but you could definitely get it to do some of the legwork for you to support you in your role.
Yeah, I love that. I could definitely do with a little bit of forward planning in my social life. Mark, I'm not always the best, so maybe I'll do a little bit of forward planning after this. Sam, I've got a question for you as well, specifically around Log My Care. I think it was Russell Philip Simpson asked, how do care providers or individual PAs access your service in Log My Care?
Yeah, well, if you're not already a customer, you can sign up online. Either we'll grant you access to a trial, or you can have a chat with one of our team and have a demo of the system. But we are generally very happy for, we're very proud of what we've built. So we're always happy to put it in people's hands, let people have a go with it first, make sure it works for their particular environment. And then, of course, our support team are always there and ready to answer any questions as you go through your Log My Care journey. So I hope that answers the question.
Yes, I believe so. But if Russell wants any more details, like Sam said, reach out to a member of the team and we'll happily walk you through or give you access. Those are all the questions that I've got. And unless there are any last minute buzzer beaters from the chat, Russell said, yeah, that's great. Perfect. Thank you, Sam. You hit the nail on the head. Those are all our questions today. I am now, as a load of people have asked in the chat, a little bit about the Log My Care rostering system specifically. Because if you haven't seen our comms on LinkedIn or via email, Log My Care rostering is out now. We've built what we think is the best person-centered rota manager there is. We think we're doing 3 things differently to some other providers on the market. We're focusing on linking care management with rostering. It's something that both Sam and Mark spoke about, making sure that information from both systems can flow with each other. We all want flexibility and customizability in the systems. That's why we baked in the ability to do shifts and visits in one place. And we've talked about this the whole time, but improving matching to improve continuity of care. Having care management and rostering together enables them to learn from each other and make sure that they're always in sync with each other. So there's never any confusion around, oh, I didn't realize I was supposed to be doing this shift with this person. You've always got all your rotas and all of those care plans and risk assessments in one place. We've launched what we think is the ultimate rota builder, enabling that person to drag and drop teams' shifts and visits for the service and publish as soon as you're ready, or hold those back if you need confirmation on anything. You can also view those in 3 different ways, whether that be by member, by team member, by service user, or by shift. And one of the most important things we did is we built a matching system to improve continuity of care. Sam spoke earlier around exactly what information that uses to match. But at the heart of it is making sure that the right carer or the right person providing care has the skills that they need to provide care for that supported person's needs, and that they are familiar with that person, or whether they're a part of that person's care team. Surfacing those matches makes that rota admin's life easier, and it makes it even more efficient without removing the human touch in the process. And I think something Sam highlighted at the end is those dashboards enabling managers, whether those be registered managers or rota admins, to get instant, immediate updates about what's happening across the service, whether that be another successful shift attended or someone running late, and enables you to follow up and ensure that everything is running just like you'd want to. And of course, this is going to be baked into the Carer app, enabling staff members to see those rotas immediately, as well as planned absences. I know we mentioned this earlier. If you are interested in learning more about the system, please head over to logmycare.co.uk/book-demo, or just go to the website and you can see a massive book a demo button to reach out to a member of the team to learn more, and I'll happily work you through the specific features, whether that be care management or rotas specifically. Perfect. That is everything from myself. And if there's nothing else from our 2 participants, I would like to thank Mark Tops and Sam Hussain both so much. Your insights have been incredibly beneficial for me, and I'm sure everyone attending the webinar will have had at least 1 or 2 golden nuggets to take away with them.
Cool, pleasure, Josh. Thanks very much.
Thank you very much.
Thank you both, and thank you to everyone who attended today.